As an HSN network, we really took a long, hard look at ourselves in terms of what the diversity agenda meant to us, particularly with our role in terms of spreading innovation. And we recognise that although there's some fantastic work that the NHS is doing in terms of diversity within its workforce, no one's really looked at the importance of diversity within innovation. And we felt that we had a leadership role to play in that space. So what we've done is we've done a lot of work this year to really understand the business case behind why diversity and innovation is so important. Important in all sectors, but obviously equally important or just as important to us in the healthcare sector. And we've looked at why we need to both ensure that people within innovation roles have the kind of experiences and a range of diversity that you'd expect from such a diverse population within the UK, but also why it's important that we're designing products and innovations and interventions that are going to be accessible and impactful for all members of our society, no matter the communities in which they live. I think when you look at the hard facts around the business case for diversity and innovation, it starts to become a really clear and obvious rationale about why this is so important. I think one of my most compelling facts is that if you have a team that has just one member of that team that shares their ethnicity with the client or the patient, the entire team is 152% more likely to understand the needs of that client or patient. And that's against a more homogenous, undiverse team. I think that simple stat just shows us why it's important to ensure that if we're really trying to understand the needs of our population, and we're doing so from a position of ignorance, diversity plays such an important, or gives us such an important opportunity to just round out the experience, not just of the diverse members of the team, but also how that enriches everybody in the team to understand our population in a much more holistic fashion. If you think about innovation and you think about the roles that we have in the NHS, if we don't ensure that those roles have the lived experience of all members of our population, then we aren't going to be able to design and implement the kinds of technologies, pathway changes, quality improvement programs that are going to meet the needs of all our population. Within the NHS, 19.1% of our staff identify as being from a BAME background. If we don't have the processes and the innovation pathways that are accessible to those staff for their ideas, then in effect, we're turning our back on 20% of all the potential ideas that the health service could be using in order to transform and greatly improve the way we deliver services in the future. It was really important for us when doing this work to make sure that we held ourselves to account, and we thought that having a series of very vocal, very transparent pledges that we were all going to commit to as an HSN network would be the way that we would do that. So we've come up with a series of pledges which can be summarised into three areas of focus. We have a whole raft of pledges around our organisations. So simply put, are we showing best practice in the way that we recruit our staff, in the way that we look to ensure that we're representative of the communities that we serve. But we also have a series of pledges around staff that work for the AHSN. So are we doing enough to ensure that we are giving all members of staff who work for an AHSN the unconscious bias training and other types of interventions which are going to allow us to make more informed decisions, not just in terms of recruitment, but also in terms of how we assess programs like our National Innovation Accelerator program, and make sure that we're not allowing ourselves to fall victim to the kind of biases inherent in some of the groups and decision making that the NHS has. And then there's also a number of pledges around our work and our impact. I think this is particularly important because innovation has the potential to both increase or reduce inequalities. And we have to ensure that the kinds of programs that we're championing and helping to spread throughout the UK are ones that have been shown by the impact equality assessments that we're going to do to be positive in terms of their impact on reducing inequalities for our population. We're really proud of this publication, and it's been an enormous effort by many, many people throughout the HSN network, and I'm very grateful for everybody's support to pull this together. In it, you'll find a really research-based business case about why diversity is such an important part of the innovation agenda. You'll find the pledges that we're making as an HSN network to hold ourselves to account. But probably most importantly, you'll find a huge celebration of some of our amazing and fantastic BME innovators who are already working with us as an HSN network, and all of whom have innovations that have been inspired by their lived experience as people with a BME background, or are directed at reaching parts of our population that some of our traditional pathways don't reach. And I think the celebration of those BME innovators and the role models that they now are for the generations that are going to follow them is such an important part of this. So I'd really encourage people to find the hard copy, find a copy on our webpage, read it, share it, tweet about it, and hopefully share some of the messages that we have in this publication and help us to spread the movement.